Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com is a burning nose sensation a symptom of COVID-19. A burning nose sensation can occur with COVID-19, though it is not as common nor well known as other COVID symptoms. When it does occur, it can cause a heat-like sensation in one or both nostrils along with a sharp, tingly, or prickly feeling. /r/n/r/n Plenty of other things can also cause nasal burning, including allergies, atmospheric changes, pollution, and other upper respiratory infections. The only way to know if COVID is the cause is to get tested. You can then take steps to alleviate the inflammation that can contribute to burning nose sensations. /r/n/r/nfizkes, Getty Imagesrnrn COVID-19 can cause a variety of symptoms, many of which affect the upper respiratory tract, including the nasal passages and sinuses. A burning nose is a possible symptom and one that is perhaps more common than people realize. /r/n/r/n A 2023 study published in the Journal of Internal Medicine reported that up to 32% of people with COVID-19 experienced nasal burning along with a host of other symptoms, including, by order of frequency, /r/n/r/n while a loss of taste and smell was also reported. Current research suggests that these symptoms, once considered the hallmark of COVID infection, may today affect as few as 6% of people due to ongoing mutations in COVID variants. /r/n/r/n Nasal inflammation is a characteristic of many upper respiratory infections, of which COVID-19 is one. While this can lead to things like runny nose and nasal congestion, it doesn't necessarily explain the burning sensations that some people with COVID experience. /r/n/r/n Some research suggests that the sensation may not be due solely to inflammation but rather a condition called paresthesia in which nerve pathways are altered. With paresthesia, a person will experience burning, tingling, or prickly sensations, most commonly on the legs, arms, feet, and hands but also occasionally on the face, scalp, and other parts of the body. /r/n/r/n Some studies report that people with COVID who have facial weakness will often experience facial paresthesia accompanied by sinus and nasal congestion. This suggests that certain symptoms of COVID-19, such as nasal burning, may in fact be a neurological manifestation of the infection rather than an inflammatory one. /r/n/r/n This is supported in part by research in which anosmia, the loss of smell common with earlier COVID variants, is caused by the dysfunction of the trigeminal nerves. These are a pair of nerves running along each side of the face that provide sensation and motor function to the eyes, upper jaw, and lower jaw as well as the nasal cavity. /r/n/r/n With anosmia, the stimulation of the trigeminal nerve may trigger sensations like burning, prickling, and stinging. As such, the same phenomenon that causes the loss of smell with COVID-19 may also trigger nasal burning. More research is needed. /r/n/r/n In and of itself, nasal burning is not diagnostic of any medical condition. In some cases, it may simply be an idiopathic symptom, meaning one with no explanation, that resolves on its own without consequence. /r/n/r/n With that said, burning nose sensations are common with conditions that cause nose inflammation or irritation, including /r/n/r/n Differentiating COVID-19 from other conditions affecting the upper respiratory tract can be difficult, but there are certain symptoms, or lack of symptoms, that point to COVID as the cause. /r/n/r/n Ultimately, the only way to know if you have COVID-19 is to get tested. You can then seek appropriate treatment if you test positive and isolate yourself from others until you fully recover. /r/n/r/n Nasal symptoms of COVID-19 can be treated with home remedies like steam inhalation or nasal irrigation. If there is nasal burning, irrigating the nasal passages with a neti pot filled with cool distilled water may help ease symptoms, but avoid using ice water that can end up causing a headache. /r/n/r/n It may also help to place a cold washcloth soaked in ice water against the sides of your nose. This can reduce inflammation if the burning or pain is severe. A cold compress can also help, but limit the application to more than 10 to 15 minutes. /r/n/r/n You can also try an over-the-counter steroid nasal spray like Flonase, fluticasone, to relieve nasal congestion, or an oral medication like Advil Sinus, ibuprofen plus the decongestant pseudoephedrine, to alleviate sinus congestion and pain. /r/n/r/n Other OTC nasal sprays like Afrin, oxymetazoline, may help but should only be used for a maximum of 3 days to avoid rebound congestion. /r/n/r/n People without risk factors for COVID complications can usually treat themselves at home. However, call 911 and seek emergency treatment if your symptoms suddenly worsen and you experience :r/n/r/n A burning sensation in the nose can be caused by COVID-19 but can also be related to other things such as a cold, flu, or sinus infection. If you suspect you have COVID-19, get tested as soon as possible. /r/n/r/n The information in this article is current as of the date listed, which means newer information may be available when you read this. For the most recent updates on COVID-19, visit our coronavirus news page. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.